I think in my own case, and I think in so many of my colleagues, it's been a steady erosion of energy, of the well springs of empathy that we have, of what we call moral injury, where we know what we need to do to deliver care to people, but the system, the perfect storm of demand, makes it almost impossible to do so often. All of these things sap one's energy, and for so many of us, that leads to burnout. And there are ways that we must address this, and so many of us who I think are driven to care for others find it really hard to accept that sometimes we've got to make sure that our care comes first so that we can be good at what we do.
How difficult, Doctor, is it to think in terms of self-care in these situations where you're not just thinking about the implications if you cannot function, if you cannot do a double or a triple shift, or you need to take a week or two or longer off, that means that somebody else has to fill those shifts, or some sick person does not get the treatment that they need. It must be a real dilemma.
It's an enormous burden. Before I made a decision with the advice of my doctor, to take 3 months off, I felt enormous guilt about letting the side down. Medicine is a team sport. You'd never deliver these things alone. And you feel really terrible about not being there to shoulder that load. But the reality is, if we don't listen to advice, and indeed it's always easier to give it than to receive it, then things will deteriorate and something will snap, and indeed we become less efficient and more likely to make mistakes in our role. And the consequences of a mistake in what I do can be catastrophic. So it's absolutely imperative that self-care is our highest priority so that we can care for others safely.
Is it your sense that now is the right time for you and others to ease off just a little, or to take a full break for a few months as you are, because the immediate crisis of the pandemic is over? Or are you still feeling that this is a crisis that has not gone away and could roll on for some time? What's the feeling there on the front line?
Well, in many of our cases, we must act now and not delay things, because, as I said, the consequences of being impaired by burnout are so severe. But I think it's a little bit of a furphy, actually, to think that it's all just due to the pandemic. That certainly has unmasked a whole number of problems within our health system, because the sources of the demand are not just the hundreds of COVID patients in hospital, the thousands in the community every day. It's things like the enormous backlogs of elective cases that need to be dealt with, the incredible surge of mental illness that we see every day, and the fact that we don't have the beds or the staff to deliver care in the sort of proportions that we need to. And so it's dealing with, if you like, crises on many fronts that has the potential to be so overwhelming.
Is there, obviously it's a complex problem and we don't know what the future will hold in terms of the ongoing infection rate from COVID and its variants. But do you have a sense of what the future looks like? Does it get easier in a year from now when there are maybe more international doctors and nurses coming back to Australia to ease some of that pressure? Or are there going to be other sort of inflection points, do you think, that we'll get to a new normal that is sustainable?
John, I think because there are so many different parts to the solutions here, any change will be gradual and it will be slow. If we look at government responsibility in Australia, it's a shared responsibility. Here in Victoria, we had a budget that's allocated $12 billion towards improving the health system, but maybe one of those measures in increasing care in the community might improve things over months, but most of the others will take years to have an effect. we're in a federal election, and I'm hearing very little from either major party about what can be done, and the solutions include an overhaul of the disastrous state of aged care and general practice, being able to look after chronic patients in the community, because as things currently stand, so many pathways end up in emergency, and the hospitals simply can't cope with these things, and the consequences are delayed care and bad outcomes, avoidable deaths.